So once you've verified all of the orders for your patient, prior to performing the phlebotomy procedure, you're going to want to gather all of your supplies. So first and foremost, you're going to need hand sanitizer to practice hand hygiene. You're going to need a pair of gloves for when you actually stick the patient. You're going to need the correct butterfly needle, the correct gauge for the patient. You're going to need either a syringe or a vacutainer to attach to your butterfly needle. For the sake of this video, we're going to attach a syringe. You're going to need a ChloraPrep to cleanse the skin prior to inserting the butterfly needle. You are going to need the correct tubes. We are going to be drawing a rainbow set, which is going to be all of the different color tubes, as well as a blood culture. So you need the blood culture bottle. You need a blunt tip needle to transfer your specimen into the blood culture bottle. And you need alcohol swabs to clean your blood culture bottle beforehand. And you also will need a tourniquet. All of your supplies prior to initiating the specimen collection, you need to open all of your supplies. If you are getting a blood culture, you need to make sure that these supplies remain sterile, because if not, you run the risk of contaminating your blood culture. So when you open your supplies, you actually want to keep them within the package, because the inside of this package is actually sterile. What I like to do is open everything like this first, okay? And keep it within that sterile casing, just like that, okay? Now, for the sake of drawing a blood culture with a syringe, which happens a lot in the pediatric patient, you need to sterilely connect your syringe to your butterfly needle. So you're gonna just simply take this cap off of the end and maintain sterility and attach the cap there, okay? Now, if you want, you can bring this packaging here so that it stays clean, okay? Your blunt tip needle, if you'd like, as long as it stays sterile, you can open that as well, but that is just gonna be used to transfer your specimen into your blood culture bottle, okay? And then you want to make sure that your Band-Aid is opened, because you're going to actually need that for the patient, okay, when you withdraw your needle, okay? If you want, you can actually take one piece off so you're not fumbling with it. So we have to go and we have to get some labs from you. Is it okay if we draw your blood?
Yes.
Okay. Can you tell me your name and your date of birth?
Isabella Smith, 04/11/05.
Okay. Can I please see your arm? Thank you. All right, this is going to
Isabella Smith, 04-11-05.
Okay. Going to be a little tight. Okay, I don't see anything there. Now I'm going to readjust the tourniquet. And turn your hands like this. Can you make a fist for me? Okay, so you have a vein here. Okay. All right. So looking at this one here, this looks like a good one. Gonna feel a small pinch. 1, 2, 3. Pinch. 1, 2, 3. To release the tourniquet. Stay nice and still. I say? You pull the needle out and you pull this tube back and it draws back the needle, okay? So now you have your specimen. You can even retract the rest of the blood that's in that specimen by pulling back on the plunger. Now remember, we are getting a blood culture, right? So you have to swab the top with an alcohol swab. Connect your blunt tip needle, maintaining sterility. Give the top of the blood culture bottle time to dry. And we got about approximately 3 mLs of blood. So you only need 1 ml for a pediatric blood culture. So you are going to inject 1 ml. And hopefully get that. And so on and so forth with the rest of your specimens. Then you want to ensure that you dispose of your sharps in a proper sharps container. The last thing you want to do is label your specimen. Proper label. And then send to the lab.